Hi, for the last few months, we are getting a lot of distress mails from young dentists and dental interns who are worried about their careers. Given the current situation, they are not sure whether they'll get jobs, whether their career will be settled. So they are under deep stress. So if you're one among them, this video is for you. In this video, we are going to discuss things that you can do both career-wise and personally, which can help you grow in this given situation. So if you're interested, stay tuned. Hi, I'm Dr. Satish Kumar and this is Kaizen Dental. Our aim here is to help dentists succeed. So, how do you navigate this situation where there is uncertainty all around, the lack of jobs, and people are confused what to do next? The first thing you can do is focus on your career. On your career, how do you go about it if you're sitting at home and not sure what to do next? The first method is explore your options. To help you out with this, we have come up with videos on various non-clinical and clinical options after BDS. You can go through them and then decide what you feel suits you. For that, knowing yourself is also important. This current time, you can spend realizing what you like. If you like working on patients, then clinical options is for you. On the other hand, if you feel that you like the more corporate type jobs, then you can go into non-clinical jobs. If you have decided you do not want to work on patients and you are deciding to do non-clinical jobs, then what are your options? You can either study further in a non-clinical course like an MHA, or you can search for non-clinical jobs which do not require you studying further. We have created content related to them as well. If you have decided that you want to continue with clinical dentistry, what is your first option? Maybe MDS. If MDS is the option for you, what other better time than to study right now? Since there are not a lot of options to do outside, studying is something you can focus on and try and crack the NEET exams which are coming. The next is, if you're keen on clinical dentistry but do not want to do MDS, you're confused. The reason being, there are less jobs out there. This is because the dentists themselves are not sure if their dental practices will continue to grow. So they have slowed down on hiring young dentists. What can you do in such a situation? The first thing is to understand what your weaknesses are. If I ask you a question that you get a job tomorrow, can you go and do all procedures directly? Is your diagnosis and treatment planning perfect? If not, use this time to improve your theoretical side of the knowledge so that when you get an opportunity, you're ready to pounce on it. So how do you go about doing this? The first thing is you can go through various Facebook groups. I've seen a lot of dentists post their entire procedures in that. And if you go down to the comment section, you can see a very professional debate about various dentists discussing how they would go about treating that case. That gives you an overall view of different treatment plans and approaches in treating the same patient or case. The second is to attend various CDE webinars which are online. There are various organizations who are providing free webinars in this time. You can find topics which you're interested in or in which you feel your knowledge is lacking and you need to improve, and attend them. The third option is to go through various YouTube videos. Yes, there are a lot of YouTube channels in which the entire procedure along with how it is done is explained. Going through them will clear most of your doubts. And let's all not forget the good old books. For example, when you read Grossman the last time, You wanted to pass your fourth year exams, so you might have studied it from that perspective. It's better to revisit these books and try and understand how you can utilize their knowledge clinically. One different option you can try is practicing certain procedures at home. How do you do that? If during your 4 years you got in a micromotor and you tried doing certain procedures at home on a diphthong teeth, similarly, you can use a micromotor, get extracted teeth and try procedures like root canal openings. If you have your own file set, you can even do BMPs. These few procedures, as you do it at home, will give you an idea of how to start when you get into a clinical practice. The next option is to approach dentists in your nearby area who are still practicing. Ask them if you can join them for observation. They might not be keen on paying you currently because even their finances would be tight. But a few of them would agree for observation. Yes, a few might turn you down because of their type of practice. But if you do not have a job currently, then observation is also a good idea in your case. The reason being, there's a lot you can learn by observing. You'll get to learn how the dentist does his diagnosis and treatment planning and how he does his consultations, how a clinic functions overall. There's a lot of difference between practicing in a private clinic and in a dental college. You'll get to understand these differences during your observation. All the advice I've given till now was focused towards your career. Now, there are certain skills which you can learn which will improve not just your career but even your personal life. These skills will help you grow as an individual. They include skills such as time management, leadership skills, and communication skills. You will tell me, why are skills like time management important right now when I have all the time in the world? But I would like to take you back to your fourth year where you had a difficult time maybe managing your time, running from one posting to another, trying to finish one quota, trying to study another subject. At that point of time, time management would have helped you. Similarly, a few years from now, when you're juggling your job, your family and other personal priorities, time management would come in extremely handy. Communication skills, on the other hand, is always important, whether it's personal life or professional life. And if you want to grow in your career, leadership skills is something which you need to develop. So using this time right now to develop these three skills will come in handy towards the future. The third thing you can do at this time to focus on growing is your fitness. That includes both your physical and your mental fitness. In physical fitness, you can do things like yoga, even something which helps you move your body like dancing or body weight exercises which can be done at home. For your mental fitness, you can try something like meditation or any hobby. It can be cooking, gardening, reading. These things will help you divert your entire attention and focus it towards your interest. That way, it helps relieve your stress. Cultivating these habits will help improve your mental strength, not just for now, but even for your future life. Before we go to what my opinion is about the current situation, I would request you, even if you got one point of this video, please do not forget to hit the like button below. And I'm sure you're subscribed to our channel because our aim here is to help dentists like you grow after BDS. Now, coming to my opinion about the given situation. Is it a tough time? Yes. Is it difficult to grow your career at this point of time? Yes. But will this time define whether you're going to be successful or not? Absolutely not. This is the difference between winners and losers. When a loser sees an obstacle, he says, no, I can't do anything about it. But when a winner comes across the same obstacle, he finds ways how to navigate through it, maybe from the right or from the left. He does not accept defeat. I want to ask you one question. Do you feel you'll never have a difficult moment in your life ever again? Or you never had one ever before? Of course not. You do not let these difficult times define who you are. You are better than these difficult moments. There have been a lot of successful people, including dentists, who have lost a ear, maybe due to an accident, maybe due to some personal difficulties, maybe they failed an exam. Are you telling me each and every person who's lost a ear has never been successful ever in life? Of course not. And I see it in you that you can be successful. You can be a winner. You are not doomed to fail if you lose a year or two, because it is in your hands to modify the career the way you want. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help people like you succeed.